Uwe Herman will talk about more research that's going on in the intersection of health and hearing, specifically the EVOTION project and the intersection of hearing care, big data, and public health policies. So please welcome Uwe Herman from Ericsson Research Center on stage.
Yeah, thank you very much. It's a great pleasure to speak to you here today. Let me first start with a little acknowledgement. This project is sponsored by the European Union under the so-called Horizon 2020 program with about 5 million euro. The two other names you see here on the chart, Nils-Henrik Matopeden, he's one of my 3 research area managers, and he's also coordinator for this project. Coordinator in this European diction means project head. And Ariane Leplan-Levesque is also one of my research area manager and a so-called principal investigator. Both, by the way, are also professors at different universities like DTU and Linköping. Yeah, World Health Organization said hearing impairment is one of the most prevalent chronic conditions and the 5th cause of disability. And it is actually increasing in its impact due to the aging of our society. So much maybe as a motivation up front why this topic, hearing healthcare in total, is so important, and why we have to think about what is the future of hearing care, how will it look like. This is a topic of this project. Let me start with a question Wall Street Journal had in June 2017. They asked, what will your iPhone look like in about 10 years' time? And a conclusion of this discussion was it will be a body area network of devices and sensors. It will probably be in the way that I would walk around and you wouldn't see that I'm having a smartphone on me or that I'm actually in the middle of some internet activities like augmented reality. Why would it be like this? Well, I would have some earbuds. They would be internet connected, so I would be able both to listen and talk with the internet, for instance, with a robot. And I would have augmented reality glasses. They would look like normal glasses, and they would give an augmented picture into my vision, probably further sensors on my body. And like this, I would be perfectly able to do whatever I want in the internet, communicate, do augmented reality, and so on. Your question might be, okay, what does this future vision of mobile communication have to do with hearing healthcare? Well, in hearing healthcare, we had about 2 years ago a very big change, something really new in technology, because since the last 2 years about, hearing instruments are now internet connected. So you connect them, for instance, via low power Bluetooth, or if you have an iPhone, by the specific interface of Apple to the smartphone directly, and like this you are internet connected. So this really opens up a complete new world, and obviously these small things here will become smaller and smaller. It is easy to envisage that all this will in the future be so-called CIC instruments, completely in the canal, so it will disappear in the ear, you will not see it from the outside, and as I said, it will connect you to the internet all the time as one of the features. So prediction for the future of healthcare is that it will be dedicated by these 4 big Ps. It will be personalized. So as Torsten indicated, we have big interperson variants of the hearing, even so they have the same audiogram. Why is it? There are lots of reasons for this. So this calls for personalized medicine, for personalized on-demand support. It will be connected with predictive advanced analytics, so that regardless what you do, it will always offer you the best solution. It will have very strong preventive elements, because as physicians say, the best and cheapest patient is a patient who never gets sick. So like this, prevention is a very big element. And it will be participatory and empowering the patients. So the patient will get many, many more possibilities. Sometimes I tend to describe today's hearing instruments like driving a Porsche always in the first gear. There are so many features we could use, which due to different reasons are not accessible. So this will really change and also make a big difference. So hearing healthcare will become a digital service. Here is a lot of text. I will highlight some of the aspects. It will give you around-the-clock and service, optimized service, and personalized. It will be hearing augmentation, so you will hear what you want. It can fade things out you don't want to hear, like Torsten indicated. It's very much about focusing on the sound source you are interested to hear. So it will be hearing devices which know your intention and your limitation. How can it know your intention? For instance, by virtue of an EEG measurement. It exchanges data with other body sensors, so it knows, for instance, on your stress, on your cognitive load. It will adjust the hearing aid processing to your current situation. So obviously, during the day, we have many different situations. It's quite different whether you are in a car or in a meeting or at a restaurant in terms of the acoustics. It will learn from your requirements and assessments, so it will become more and more personalized. The more you use it, it will learn about you. It collects data and presents the outcomes to you, to your hearing care professional, which is helping you, and also to policymakers. Policymakers obviously are very much interested in collecting evidence that the instrument is really providing a benefit, because healthcare is expensive, so it's always the question, does it really produce the benefit we want? And it will exchange data with other care domains. So EVOTION project under this Horizon 2020 is an attempt to look into this future and to experiment with some of these aspects. So what we are doing is we have about 1,000 or a little bit more hearing aid users in this project. They are receiving hearing instruments from us. They are highly personalized, so they are actually standard products, but with a lot of add-on features. They are connected via a radio interface to a smartphone with a so-called EVOTION app, and these people have other body sensors. Again, it's a standard product you can buy off the shelf. It's a watch which can, for instance, measure your pulse. So it's the attempt to couple hearing aids and biosensors and the mobile phone in order to log data, like, for instance, user operation patterns, hearing aid use, the sound environment, biosignals, for instance, for stress, and also the rating of the listening experience. And all these are real big new things. Just to pick one up for you, a sound environment, until now, it was typically so that user went to the hearing care professional and said, last week I had a problem. I was at the party of my aunt Sophia and I couldn't hear really good. And the hearing care professional is a little bit lost because he or she wouldn't understand, okay, what was the sound condition there? Here we can take sound snippets and characterize these situations. So like this, we are addressing these three parties here, the patient himself, the healthcare professionals, and the policymakers. All this is by virtue of a big data engine, so all the data are collected in the cloud. We are making decision simulation, and we are also connecting to additional clinical repositories, so we can connect to clinical data of these patients. This is a complete list of the, or not even complete, but a quite overview list on the data we have. We have for more than 35,000 patients, clinical data in this repository, like audiological data, psychological data, cognitive data, pharmacological data, occupational, and so on. So it's a real big database. And for these 1,000 users, we have the logging data I just mentioned, like sound pressure, signal-to-noise ratio, modulation, and so on. Also their own rating of the hearing aid benefit. Does it help me? Does it not help? Self-administrated in situ audiometry, so they can do some audiometric tests by themselves, self-managed fine-tuning, and so on. So it's a really huge data engine we are building up here. This is really about big data. And like this, the project is addressing these three elements which are dedicated here in these bubbles. It's about prevention. So we try to do noise monitoring and audiometry in order to prevent hearing loss. This is pretty important because in many cases hearing loss is, in quotation marks, self-inflicted due to exposition to too loud noise due to whatever reason. So it's personalization, so the hearing instrument settings are very much adapted to the individual user, and the user himself or herself has a great ability to change settings. And it's about treatment, giving auditory training and support. Regarding these 1,000 patients, there are these 4 university hospitals in England and in Greece. And as I mentioned before, it's about public hearing health policy. You have to imagine this is the overarching big question of the authorities, obviously, is, okay, when hearing loss is such a prevalent disease, what can we do in order to prevent it? And how do the pretty expensive hearing instruments we're giving to the patients help the patients? Obviously, it's about getting the evidence that this is really working. So a little bit about the personalized hearing aid settings I mentioned before. As Torsten said, we are actually hearing with a brain. It's a brain which is making a sense out of the sounds. And we have a big variance between people, even so they have the same audiogram. So this is sort of depicting a little bit the challenge you have when you go from simple listening situations to complex situations. And when you have a little help here or a lot of help by the hearing instruments, these are typically fitting curves where you can see how the audiologist is fitting for users with low, medium, or high need for support. In EVOTION now we have the capability to measure the sound environment, so we can understand, okay, what was happening. We can look into the signal processing, okay, what was the engine inside the hearing instrument doing about this. We can see the user behavior, for instance, user toggling between different programs. The user can also rate the hearing experience, and we have at the same time physiological data. For instance, we can see was it in the move, was the user in motion, was there stress, was a high pulse rate, and so on. So like this, personal hearing, brain hearing is a big step from the standard hearing care we have so far into the future hearing care. It's, as I said, about personalization of hearing settings by learning from its use. The user can choose among settings when needed, so the user has much more influence on how the instrument is working, and the user rates settings as they wish. Big change as to before. As I said before, it was typically so that the user had to go to the hearing care professional, ask for a change, and then the hearing care professional would do this. And you would only have the choice between 2 or 3 programs which are pre-programmed. So as I said, it's like driving the Porsche now, not only in the 1st gear, but coming up in the 4th gear also. This is a bit of a glimpse. This shows how the sound environment was. And here something happened. The user switched the program. So one can, afterwards, with the user, reconstruct it and say, okay, what happened here? Why did you change? How did it help you? What was the consequence? So much maybe for the overarching thing of personalization. Now a short look at the stakeholders. I mentioned before, we have the public policy makers, we have the users themselves in the center, we have the engineers like us trying to understand how is the hearing instrument being used, how can we optimize it, and we have the clinical staff who need to help the user. All 4 are involved actively in this project. So it's a big step, obviously, then to come from all the data we are collecting to making something useful out of this, also to create information and then to create new policies. So it all starts, of course, with collecting and storing data, profile and diagnose the client, match client and treatment, also try to find the best match here, treat and measure the outcomes, and refine the database and decision support, and start again with data collection. That's basically the process which is running in the project. And the data, of course, it has pretty different meaning depending on who is looking at this. So it creates different insights for the policymaker. Again, it's about evidence and background data. They want to understand how can they protect hearing, how can they make it the healthcare system cost efficient. The technical guys like ourselves in industry, we can try to understand how real-world data are looking like, what we use the complete world as a lab. The healthcare professionals, they need it for outreach, to contact the patients also when they're out, to get insight into the use. And for the user, it's about personalization and empowerment. I have a little bit of time maybe for a short personal anecdote from my past. About 15 years ago, I was involved in my previous employer in a project which was called Car ITIL, where for the first time a radio connection to the cars was created, and motronic data of the car engine was all the time sent back to a service center. And for the car manufacturers, this was really like going through the sound wall, because before they could only see the dealers, which were selling the cars to the end users, and now suddenly they could see how the cars were used by the end users. So I was working, for instance, with BMW at this time, and for BMW it was a huge step, because they suddenly could understand how the people really are using their engines, so they could optimize and like this make it more efficient. So they could cut down things which were over-engineered, they could improve things which were not good enough, and like this they could give, without extra cost, 3 years guarantee time instead of the 1 year before. So this is really a huge thing which is happening here also for industry. So the hearing perspective is hearing care is going to be digital. The data will transform how care is being provided. The service empowers users to interact with hearing solution 24/7. It's not only when you are with the audiologist, and the data facilitates personalization and seamless follow-up. The applied methods obviously apply for many diseases and conditions. You may also imagine, for instance, diabetes. You could do similar things with a diabetes pump. So our company like this gets personalized device settings in the field. We learn from single users and groups of users, and we gain experience on near future evaluation of care that spans the user, health professional, and policymaker. So it's really like looking into the future. You will find more under this link here. And finally, again, I want to acknowledge the partners. You can see it's a typical European project, very international, very many partners. And as I said, we are very grateful for this 5 million funding by the European Union, which allows us like this to do a look into the future. Thank you very much for this. Thank you very much for listening.
Thank you, Uwe. Thank you very much. And we'll just once again change microphone for the last speaker of the 3 panelists. And again, I'll try to distract you with silly anecdotes from my own life. I used to be a radio program host, actually with Henrik, who's down there. Henrik, just wave your hand. We used to host a radio program, and once we got an email from a listener who said, thanks very much, I really enjoy your program, the sound of your voices is great to fall asleep to. So I always thought of that as a great compliment, but I guess I shouldn't. I'm just letting you know, because if you all fall asleep while I'm talking, it's okay. It's not okay to fall asleep while Jan is talking.